This video is about the ninth cranial nerve, known as the glossopharyngeal nerve. You should be able to get an idea that glosso means tongue, whereas pharyngeal tells us that it has something to do with the pharynx. Glossopharyngeal nerve is derived from the third pharyngeal arch. It is a mixed nerve and it has all the three components. Let's talk about the sensory component first. The nucleus for this component is nucleus tractus solitarius. Sensory component can be divided into general and special components. In the general component, there are touch, pain, and temperature sensations. In the special sensory component, we have taste only from the posterior one-third of the tongue. Also note that the sensations from the posterior one-third of the tongue, tonsils, and posterior pharyngeal wall are carried by the glossopharyngeal nerve. Let's move on to the motor component now. The nucleus for that is nucleus ambiguus. It supplies the stylopharyngeus muscle. Parasympathetic component. The nucleus for parasympathetic component is inferior salivatory nucleus. It goes through the lesser petrosal nerve to the parotid gland. All these nuclei are present in the lateral aspect of medulla oblongata. The nerve exits lateral to the medulla oblongata and it comes out through the jugular foramen. Now the second last part of the video is the branches. The first branch of this nerve is the tympanic nerve. It will participate in the formation of tympanic plexus in the middle ear cavity. Tympanic plexus will give off a branch, lesser petrosal nerve. In the otic ganglion, lesser petrosal nerve unites with auriculotemporal nerve. How did it reach the otic ganglion? That's a question. From the inferior salivatory nucleus, the glossopharyngeal nerve through its branch, tympanic nerve, goes to the tympanic plexus, and from there the lesser petrosal nerve enters the otic ganglion. The second branch is the carotid nerve. It plays an important role in respiration and blood pressure. It does so by supplying the carotid body and carotid sinus. Carotid body is a chemoreceptor, whereas carotid sinus is a baroreceptor. Both of these are present at the bifurcation of the common carotid artery. The third branch is the pharyngeal branch. It supplies the mucous membranes of the pharynx. Then comes the tonsillar branch. It carries general sensations from the tonsils. The lingual branch carries general and special sensations from the posterior one-third of the tongue. And then there comes the muscular branch of the stylopharyngeus muscle. In case of a lesion of the ninth cranial nerve, you see the loss of gag reflex. Sensory component of a gag reflex is absent. There is loss of taste sensation from posterior one-third of the tongue. If the video is a help to you, don't forget to subscribe. Comments and feedback is most welcome. If you find a mistake in the video, kindly let me know in the comments so that I can correct it and pin your comments to the top. Thank you for taking out time to put in your valuable feedback.